Assessment of a patient presenting in emergency with loss of consciousness. Hello, everyone. This is Dr. Nakvi, and today I'm going to talk about the patients presenting with the loss of consciousness into your emergency. This video is specifically for interns, residents, and the people who are working in medical emergencies, often in which the patients present with this complaint. First of all, हमें ये पता होना चाहिए कि why do a person loses the consciousness. There is a complex interdigitation of neurons in the brain, in the area of reticular activating system. So in short, anything that affects reticular activating system, that can lead to loss of consciousness. So loss of consciousness does not wholly solely depend upon one system. Okay, any system that is going to affect your reticular activating system anyhow by any mean can cause loss of consciousness. For example, if you start from the brain, epilepsy can cause loss of consciousness. Then infection can cause meningitis, can cause loss of consciousness, and above all, the CVS can cause loss of consciousness. There is a massive one. It will ultimately affect that reticular activating system and can cause loss of consciousness. If I come towards the chest, there are two systems in the chest. One is heart. How does heart can cause loss of consciousness? Well, if there is arrhythmia and there is no blood supply to the brain, it can definitely lead to loss of consciousness. Another thing is somehow the person lands into hypoxemia, like syncope, aortic stenosis, a little exertion, the supply to the brain is cut off, person loses conscious. What about the lungs? Everyone knows that a person with COPD can present with CO2 narcosis that will ultimately affect the reticular activating system, the brain, and the patient will ultimately land up into loss of consciousness, losing his consciousness. If we move towards the abdomen, specifically talking about the GIT, any type of portosystemic encephalopathy, I mean, not any type, but the portosystemic encephalopathy secondary to any cause can lead to loss of consciousness. The basic pathology. There are imbalance in the excretion of pneumonia, ammonia. It goes towards the brain, affect the reticular activating system. The patient tends to sleep and loses consciousness. What about the kidneys? Kidneys, ultimately, chronic renal failure can lead to electrolyte imbalance. Again, there is a complex pathway that will affect the brain activating, reticular activating system and can lead to loss of consciousness. What else? Musculoskeletal. Musculoskeletal will definitely affect the breathing patterns of a patient. For example, a person goes into respiratory failure. Again, the oxygen supply to the brain is cut off somehow and the person loses the consciousness. What might be the other causes? For example, let me tell you, electrolyte imbalance, hyponatremia can cause loss of consciousness. Drugs can cause loss of consciousness, whether recreational drug or sedatives. Then there is poisoning. First of all, there are four vitals that are very important for a patient: respiratory rate, blood pressure, heart rate, the pulse, and oxygen saturation, temperature. These five vitals, they will give you a clue. There is another vital that is very important, that is often missed in a patient who is unconscious. That vital is blood sugar levels. Always do blood sugar levels in a patient presenting with the consciousness, loss of consciousness. Now, if you start from the head, the CNS system is at the top. Do not miss checking these things. Go for the GCS. Obviously, patient have lost the consciousness, GCS will be low in that patient. Then look for the pupils. response of pupils to the light. It will definitely give you a clue for the loss of consciousness. Then do the signs of meningeal irritations. Okay, Brudzinski you can do at that very time during your assessment. And then kerning sign. It will be definitely giving you a clue about the meningitis. And the most important thing you should never ever miss in a patient with loss of consciousness, that is the planters. Always see the planters. If it is not upgoing, it is mute, even then it is abnormal. Okay, you are done with CNS, straight away go towards the heart. In heart, what might you find? Any abnormal sound, any third heart sound, or any murmur for the aortic stenosis? Go towards the lungs. Prolonged expiratory wheeze, you can find it. Any bronchi, you can find any abnormality that will point towards the cause of loss of consciousness due to your respiratory system. If you go towards the abdomen, what can you find in the abdomen? There's a present the patient who are presenting with portosystemic encephalopathy, there's a very characteristic abdominal appearance. The signs, yes, of course, I'm talking about the signs. Often these patients have signs of liver failure, portosystemic encephalopathy, secondary to liver failure, things like that, in which you can see the everted umbilicus, stria, prominent veins, abdomen will be protuberant, giving a hint of fluid in the abdomen, ascites. And if the patient is CKD patient, he will be a thin lean patient. You will definitely come, with the experience, you will come to know that it might be a patient of CKD. Now that you have done the CNS, I mean, all the examination, you didn't find any clue. Look at the age of the patient. If the patient is an elderly patient, irrespective of gender, think of infections, electrolyte imbalance first. Infections like sepsis secondary to UTI is very common in bedridden patients. It can present with the loss of consciousness, many times secondary to sepsis and multi-organ involvement. If the patient is young, it could be drugs intake, whether recreational or psychotropic drugs. If a patient is a psychiatric patient and has been taking certain medications, it could be side effect of that. Now, there is another concept for evaluation of these kind of patients presenting with loss of consciousness. If the patient is very shabbily dressed, I mean, he's not very clean and, dressed not very well, it could be addiction, recreational drugs. So the general outlook of the patient will give you a clue to see which kind of system you should proceed in examination first. Now, this approach in the examination, looking rapidly to all the system, will definitely give you a clue which to approach and how to, which system to approach first and how to approach it as a patient, as a doctor, any patient presenting to you with these kind of complaints. So to recapitulate everything, just when a patient comes to you with complaint of loss of, the patient is obviously having loss of consciousness, and you have checked the pulse, you have checked the breathing pattern. If there is a pulse and breathing, patient is breathing, now you should do the assessment, the thing, the assessment algorithm I have told you. If the patient is not having pulse or he is not breathing, then there is altogether a different story to go into emergency CPR or things like that. This algorithm is for those patients who present to you with palpable pulse and breathing pattern. There is breathing. So rapidly check all the vitals. Don't forget to do your BSR in that patients and rapidly examine from head to toe. It will take 1 minute, but it will give you many clues what could be the possible cause.